Congresswoman, good evening. Good to have you back.
Thank you so much. Appreciate it, Joshua.
Explain how this patent waiver program would work. What's the process?
Well, let me first tell you that the President of the United States, because he made the decision he did this week to allow for that process, can save hundreds of thousands of lives. Here's what it says, is that countries like India could manufacture their own vaccines if given the recipe and given some of the know-how. And so we wouldn't have to rely on the pharmaceutical industry, who has really been blocking this ability for poor countries to make their own vaccines. And so this is such an incredibly important decision, and there is capacity around the world in every section of the world to be able to do that kind of manufacturing. And so it's really just saying to the pharmaceutical companies, we're not going to allow profits over the lives of millions of people around the world. You're going to have to help now, and you're going to have to share that recipe and the know-how so that other countries can have a chance.
Now, the CDC is expecting a sharp decline in cases here by July, provided that people go get vaccinated. And if you haven't yet, you can go to planyourvaccine.com to get information about how to get vaccinated where you are. If you compare the number of cases in the U.S. versus India, it's a huge variance. I mean, you can see where India has sloped up very sharply, where the U.S. is finally trending down consistently. Some countries like Germany and France are suggesting that we focus on shipping more of the stockpile rather than a patent transfer. Why not focus on that instead?
Well, I think if we want to donate leftovers, that's fine. And I think that would be very helpful as well. But the idea is what the World Health Organization said, that there have been 1 billion doses distributed, and 0.3% of those have gone to poor countries. So we have there's so much need right now that it's not just a matter of, boosting up our production or getting some other countries. They need to be able to produce them themselves. We are talking about needing 14 or 15 billion more doses. And this is a way that we can do it. And hundreds of countries across the world have been begging for that. And the majority of Democrats in the House of Representatives, in a letter that I led, asked President Biden to do it. And I think it's just a very courageous and an excellent life-saving move that he made. And we have a trade representative right now, Catherine Tai, who went to the WTO to announce this is the position now of the United States.
Vaccine manufacturers have also said that just because you share the recipe doesn't mean that it's going to turn out the same from somebody else as if they make it themselves. What about quality control concerns? If, companies that are offered this intellectual property maybe don't manufacture it to the standards that the manufacturers, that the drug makers themselves might?
Yes, they've been trying to demean the ability of these countries, many of which have the technological expertise. They have the science, the advanced scientists that can do this. There is some capacity to actually get this thing in motion during this year, if they were only allowed to do it. And so we would like them to share their know-how as well with these countries, but there's no reason to believe, there's no evidence to say that they are incapable right now of doing it. And in fact, a former head executive at Moderna says he thinks that it can happen under the right circumstances within this year, that we could have much more supply of vaccines.
Illinois Congresswoman Jen Schakowsky, I appreciate you coming on to talk about this with us. Thanks very much.
Thank you so much.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.